Hello, I'm Dr. Biplab, Director, Neurology and Neurointervention at Batra Hospital and Research Center, New Delhi. So today I'll be talking about stroke. Stroke, paralysis. It's one of the most devastating medical and surgical emergency and can happen to anyone at any time in a fraction of a moment. And the life changes forever. So today we'll be talking more about how to recognize stroke, because as I say, so can happen to anyone at any time. So the person, the friends, the family members should know how to recognize it so that you can identify it easily and reach to a center where stroke facility is available. Before that, just to give you an idea, how severe and how common is stroke. Just years back, there's a slogan. The slogan which was more, all over the world, that slogan was 1 in 6. So 1 in 6 in an adult can have a stroke. Just within few years, this has changed to 1 in 4. So 1 in 4 among all our adults can have a stroke. And a stroke is such a devastating thing, can impact not only the old person, which is earlier we had a thought that the old person only have the stroke. It's not like that, because we are seeing so much of a young person, even in their 20s, in their 30s, having a stroke. And you can imagine somebody who is having a stroke, the whole family get shaken by the impact, because they are the pillar of the family, and because of this stroke, there is significant impact on the family, and not only the family, the society, and as a whole, other nations as well. So that's how the importance of stroke is there, and that's how we need to understand stroke symptoms. We need to recognize the stroke symptoms early. So there are so many acronyms which is available. One of the most common acronym which is available all over the world is called FAST, F-A-S-T. So that stands for F for facial deviations. If the person is doing fine and suddenly there is a deviation of face, so how to recognize or how to see it? You can ask the person to show his or her teeth like this way, and there will be some facial deviation. Okay, F for facial deviation. A for arm weakness. So if there is the person is doing fine and suddenly there is some arm weakness or drooping, not able to handle something or holding something. There is a weakness in upper limb, or the person is not able to walk, and there is a weakness in the legs. So these are the symptoms of a stroke. And in subtle cases, if you want to look for subtle weakness, if you can ask the person to hold the hands like this and look for a drift. This is called drift. Look for a drift within 30 seconds, right? And other than this, S for speech. The person is doing fine and suddenly the speech has become slurred, or the person is not able to speak at all. So this can be symptom of stroke. Then comes the T, F-A-S-T. So T stands for time. So it's not actually the symptoms, but it is time. The T stands for time. It signifies the importance of time in stroke patients. So as we said, stroke is such an emergency thing, such an critical things which we recognize within that golden time. There is a golden time, and if the person who is being affected with the stroke get treatment within that golden time, the chances of recovery is very, very high. And the good news is that there is a very effective, I repeat, effective treatment is available where we give an injections to dissolve the clot which has gone into the brain and caused the stroke. Or there are devices, there are facilities are available where we reach into the brain and take out the clot. So all this treatment, effective treatment, can happen provided we reach in hospital or reach in stroke ready center within that golden time. And the golden time is within 4.5 hours. But saying so 4.5 hours, it does not mean somebody's family members has identified the symptoms, like within 1 hour or within minutes you have identified that this person might be having a stroke, and you wait for 4.5 hours thinking that I'm having 4.5 hours. Never do that, because as early as you identify the symptoms, as early as you take the treatment, the effective treatment, the chances of complete recovery is very high. And that's why we need to, take this, we need to understand the symptoms, we need to spread this awareness among all of us, our friends, our children, our grandpa. Everybody should know these symptoms identification, because that is very, very crucial. So through this video, I would like to, attach you all, so that, we can spread this awareness about identifying stroke and reach to a nearby stroke ready center where comprehensive stroke care is available. In our follow-up videos, we'll be talking about what are the effective treatment available, what are the risks, what are the benefits, and how we can avail the treatment. We'll also be talking about why stroke is happening, why stroke is, there are young guys is having a stroke. So we'll be talking lots about that. Thank you very much for being connected with us. Thank you.